Heart. Muscular pump that continually replaces the cell's surrounding environment so that waste can be removed and nutrients can be supplied. Heart characteristics. 1. Size of a person's fist. 2. Beats and average of 72 times minute or 100,000 times day. 3. Location in chest within a cavity called the mediastinum, also shifted to the left side. 4. Lower tip is the apex and it points to the left. Patient's left base is where the great vessels attach to the heart. Pericardial sac. Covering of the heart. Pericardium, loosely fitting, fluid-producing sac covering the heart, yields a frictionless environment. Parietal pericardium. Outer layer of serous that forms part of pericardium. Visceral pericardium. Inner layer of the serous pericardium, that is part of the heart wall, also called the epicardium. Pericarditis. General inflammation of any part of the pericardium. Cardiac tamponade. Case of pericarditis in which excessive quantities of fluid actually hinder the beating of the heart, result in very low cardiac output. Epicardium. Also called visceral pericardium, outermost, somewhat thin covering, usually laden with fat. More fat means more effort of the heart to pump equals more likelihood of heart attacks. Myocardium. Cardiac muscle, thick layer of the heart. Endocardium. Very thin, innermost lining of endothelium, same as the layer as the capillary. Atria. Receive blood coming into the heart. Ventricles. Eject blood from the heart. Pulmonary circuit. Blood direction towards the lungs. Systemic circuit. Blood direction through the rest of the body. Mitral valve or bicuspid. The left AV valve consists of two flaps of endocardium. Papillary muscle. Small muscles within the heart that anchor the heart valves. Chordae Tendineae, tendinous cords. Tiny white strings that anchor the flaps to the walls of the ventricles. Tricuspid. The right AV valve consists of three flaps. Semilunar. Valves that act to stop blood flow back into the ventricles. Atrioventricular valve. A term that includes mitral, bicuspid or tricuspid, located between the atrial and ventricular chambers on each side, prevent the backflow into the atria when the ventricles contract. Prolapsed-incompetent valve. Weakened valve actually leaks, results in heart repumping blood, decreases efficiency, heart murmur. Coronary arteries. 1. Blood supply to heart. 2. Two mains of these arteries left and right, 3 branches off these main vessels are the circumflex and the anterior and posterior interventricular arteries. 4. Arise from the aorta just distal to the aortic valve. Angina or angina pectoris. Chest pain, spasms of the myocardium, due to temporary O2 deficiency because of blockage in cardiac circuit, due to either stress-induced spasms of coronary arteries or increased physical demands on the heart. Referred pain. Pain of one region, area that is felt in another area. Classic location in addition to chest areas is left arm and occasionally neck and face. Coronary, myocardial infarction or MI. Bypass surgery. Blocked or damaged blood vessel is bypassed by a replacement which is necessary to re-establish blood flow to cardiac tissue. Blood flow to cardiac tissue. Blood vessels used are taken from the leg or chest, CABG, coronary artery bypass graft. Balloon angioplasty. A catheter with balloon at tip is inserted at site of blockage to press fatty deposit against artery wall. Doesn't last long, good for weaker patients, coated with heparin so it doesn't cause clotting of blood. Stent. An expandable tube inserted into a blocked artery. Excellent lifespan, done as an outpatient. Properties of cardiac muscle. 1. Striated to lots of mitochondria. 3. Intercalated discs, allows for cells to function as a unit. Cells interlock. 4. Branching. Intrinsic innervation of the heart. Conduction system of heart. Ability of heart to contract. Nerves not required. This system sets the basic rate of heartbeat. Sinoatrial node. Pacemaker of the heart, located at the superior vena cava, right atrium junction. Sinus rhythm. Synode, also called intrinsic rhythm, produced by these modified cardiac muscle cells. No nerve impulse necessary. Sets pace, usually about 70 to 80 beats, min without nervous system, electrical charge, average 72 beats per minute. Atrioventricular node. 1. Location in septum between two atria. 2. Function, picks up stimuli from synode and carries to AV bundle, her bundle of his. AV bundle, her bundle of his. 1. Location, bundle of fibers that extend down interventricular septum. 2. Function, conducts impulses to bundle branches. Bundle branch. Basically SMAE is bundle of his. Note location in the interventricular septum. Purkinje fibers. Branches of bundle fibers that conduct impulses through muscles of both ventricles. Contraction of the heart begins at the apex and spreads toward atria. Arrhythmias. Irregular heartbeats. Fibrillation. Rapid and irregular contractions, non-productive action, no blood pumped, fatal, caused by intrinsic nodal system malfunction. Defibrillation. Electric shock wipes slate clean, helps to restore the regularity of beat by depolarizing the entire heart, then allowing it to restart. Heart block. Damage to the AV node. Essentially the entire conduction system is blocked and the ventricles must resort to contracting at an intrinsic rate, which is a much slower rate. Pacemaker. Artificial pace setter, which takes care of the heart block problem. Several types. Extrinsic innervation of the heart. This system acts as both the brakes and accelerators of the heart. Sympathetic nervous system. The autonomic nervous system, increase the heart rate, fight or flight. Parasympathetic nervous system. Rest or digest, the division of the autonomic nervous system that calms the body, conserving its energy, lowers heart rate and blood pressure. Electrocardiogram, ECG or EKG. Measurements of electrical charges generated and transmitted by the heart, represents conduction, not contraction, that can be recorded in studies. P-wave. Movement of impulse from synode through atrial muscles, contraction of both simultaneously, in on. ECG corresponds to depolarization of the atrial fibers, leads to contraction. QRS complex. depolarization of ventricles, contractions, spread of electrical impulses through ventricles, atria, are relaxing but are masked. T-wave. Repolarization of ventricles, relaxation. Cardiac cycle. All events associated with one heartbeat. Heart sounds S1 or lub. Atrioventricular valve mitral. Heart sounds S2 or dub. Semilunar valves closing, the second heart sound. Murmurs. 1. Unusual heart sounds. 2. Blood flows silently unless it is obstructed, in which case it causes turbulence and sound. 3. Common in young children and some elderly. 4. Valve status must be checked and monitored. Blood pressure. Systole, dystole, normal 120/80ths, the pressure of the circulating blood against the walls of the blood vessels. Systole. Pressure exerted by contraction of ventricles. Diastole. Pressure exerted by relaxation of ventricles. Atrial systoles. Contraction of the two atria. Ventricular systoles. Contraction of the two ventricles. Why do we need to control circulation? 1. Maintain blood movement. 2. Vary volume and distribution pattern. 3. Deliver oxygen and nutrients, and carry waste away. Cardiac output. 1. Amount of blood pumped by each ventricle in 1 minute. 2. Cardiac output equals stroke volume, AMT of blood pumped in 1 contraction x beats minute, or of cardiac cycles. 3. CO equals SVXHR. Regulation of stroke volume. Starling law. 1. Starling law of the heart. A. Amount the heart ventricles is stretched by contained blood. B. Greater the stretch, greater the contraction. C. Venous return volume in ventricles is determined by heart rate, exercise, and fluid loss. Regulation of stroke volume. Heart rate. A. Sympathetic division, epinephrine increase heart rate. B. Parasympathetic division, slows heart rate. C. Other factors, ions, electrolytes, calcium and potassium in particular affect HR. D. Age, gender, exercise, and body temperature. Female heart rate. Average 72 to 80 beats per minute. Male heart rate. Average 64 to 72 beats per minute. Normal range of heart rate. 60 to 100 beats per minute. Tachycardia. Heart rate over 100 beats per minute. Bradycardia. Heart rate below 60 beats per minute. Congestive heart failure, CHF. Pumping efficiency of the heart is so low that tissue needs are not met. TCAN occur on either side of the heart, but weakness to one side stresses the other side, typically a deteriorating condition. Due to a. atherosclerosis, blockage of coronary vessels, b. persistent high BPC, multiple MIs, heart attacks, hence death of tissue and replacement with scar tissue, d. cardiomyopathy, stretched ventricles become flabby and muscle deteriorates. Blood vessels form a closed-loop delivery system that begins and ends at the heart, although somewhat pipe-like.
They are actually quite unique because they can pulse, constrict, and even spread, grow into new
areas, quantity in body about 60,000 miles. Types of blood vessels: arteries, arterioles, capillaries, venules and veins. Flow pattern of blood vessels: heart pumps greater than, blood flows through arteries, larger than, smaller than, smallest, greater than, capillaries greater than, veins, smallest to largest, greater than, back to the heart. Tunica intima. Layer of blood vessel, endothelium, one cell thick layer of simple squamous epithelium, next to the opening, lumen, of the vessel. Tunica media. Layer of blood vessel, circular arranged smooth muscle and elastin fibers. This layer is usually thicker in arteries than veins. Sympathetic nerve fibers control this muscle layer. Tunica externa. Layer of the blood vessel, mostly loose connective tissue. Artery. Carry blood away from the heart, carry oxygenated blood, except pulmonary. 1. Innermost layer endothelium, single cell thick. 2. Thicker walls. 3. Function, transportation, also resistance, and blood pressure. Vasoconstriction. Contraction of blood vessels, relate to arteries not veins. Sympathetic nervous system. Vasodilation. Relaxation of blood vessels, relate to arteries not veins. Parasympathetic nervous system. Arteriole. Smallest artery, have only a few muscle cells wrapped around them. Major site of blood pressure regulation and blood flow to body parts. Capillary. Microscopic, single-cell thick layer, RBCs through one at a time. 1. Function, exchange site or point of diffusion of food, waste, and gases. 2. Estimated that every second or third cell is near a capillary, although some tissues have more capillaries than others. Precapillary sphincter. Surrounds the root of each true capillary and acts as a valve to regulate the flow of blood into the capillary. Capillary beds. networks of capillaries that functioned almost as a unit. Venules. Little veins. Veins. Blood flow is toward the heart. Blood is deoxygenated. Expect pulmonary function, transportation, and reservoir can hold up to 65% of total blood volume. Vascular Anastomoses. Reconnection or alternate of blood vessels, either arteries or veins, post a feature because it supplies alternate route to tissues, thus ensuring their survival. Circulation. To keep us alive, blood must be kept circulating. We are now aware the heart is a pump, the arteries are conduits, pipes, the arterioles are resistance vessels, the capillaries are exchange sites, and the veins are conduits and blood reservoirs. Blood flow, also called cardiac output, measured as volume flowing through a structure in a period of time. Blood pressure. Force exerted by blood on the wall of a blood vessel, expressed in mm of Hg. Mercury. Loss of blood volume causes drop in blood pressure. Peripheral resistance. Opposition to blood flow, the amount of friction encountered by blood as it flows through the vessels. Three factors of peripheral resistance. 1. Blood viscosity. 2. Blood vessel length. Longer equals more friction. 3. Blood vessel diameter. A flexible, changeable factor. Systemic blood pressure. When fluid is driven by a pump, the heart, through a circuit of closed vessels, there is pressure. Blood flows from high to low pressure. Blood pressure changes when blood flow encounters resistance. BP is highest in the aorta and lowest in the vena cava as blood enters the heart. Main factor that influences BP. BP equals COXPR, blood pressure equals cardiac output x peripheral resistance. Alcohol promotes vasodilation, red-faced look, drop in BP. Kidneys are renal. Long-term control of BP due to mechanism alter blood volume. Pulse. Rhythmic expansion and recoil of arteries due to heart contraction. We equate it to the heart rate. Pulse points. 1. Common carotid. 2. Brachial. 3. Radial. 4. Femoral. 5. Feet. Hypotension. Low tension pressure, generally a systolic hash of under 100 mm Hg. Orthostatic hypotension. Dizziness due to sudden changes in posture, usually found in elderly, caused by slow nervous system response. When you suddenly get up from a resting position, your blood pressure drops. Chronic hypotension, often due to nutrition, especially iron, usually female. Acute hypotension, sudden onset caused by circulatory shock, usually trauma patents. Circulatory shock, inadequate blood volume and hence blood flow. Hypertension, high blood pressure, defined as 140/90ths consistently or higher. 30% of people over 52 can result in heart failure, vascular disease, renal failure, and stroke. 3. Stresses heart wall, enlarges and becomes flabby. 4. Accelerates atherosclerosis, blood vessel tears. 5. No cure but lots of potential to control problem. 6. Known as silent killer. Factors of primary hypertension. 90% have this type of hypertension: diet, obesity, age, race, heredity, stress, smoking. Blood flow changes during exercise. 1. Brain remains the same. 2. Muscle lots more with exercise. 3. Skin some additional with exercise. 4. Abdomen less with exercise. Coronary artery disease, fatty, calcified deposits in heart blood vessels. Aneurysm, a balloon-like outpocketing of the artery wall, places an artery at risk for rupture, maybe congenital, birth defect, but more likely due to hypertension or atherosclerosis. Likely sites include aorta, and arteries in brain. Angiogram, diagnostic technique using radiopaque to show blood vessel blockage, damage. Phlebitis, inflammation of a vein with associated pain, throbbing, and redness of the skin over the inflamed area, usually caused by bacterial infection. Thrombophlebitis, intravascular clotting often following phlebitis, particularly dangerous if clots become detached and form an embolus. Atherosclerosis, hardening of the arteries, changes in the elasticity of blood vessels, condition in which fatty deposits called plaque build up on the inner walls of the arteries. Angioplasty, an operation to repair a damaged blood vessel or unblock a coronary artery. Sphygmomanometer, a pressure gauge for measuring blood pressure. Carrot cough sounds, tapping sounds heard during auscultation of blood pressure, heard with sphygmomanometer. Varicose veins, abnormally swollen, twisted veins with defective valves, most often seen in the legs, can be caused by excessive standing, pregnancy, diabetes, high blood pressure. Hemorrhoids, swollen, painful rectal veins, often a result of constipation or pregnancy. Cardiomegaly, an abnormal enlargement of the heart. Myocardial infarction, destruction of heart tissue resulting from obstruction of the blood supply to the heart muscle. Heart attack.